Oh, it's 9 o'clock in the morning. It's gone already. Wish I could afford it. Where to, sir? Where are you going, sir? Oh, 10 dinners, sir.
Well, I'm perfectly satisfied with your physical condition. For a man of your age, you're in excellent shape. Blood pressure's all right at rest. A bit over-responsive to anxiety, but it settles perfectly well. What I'm not satisfied about is your anxiety and the underlying depression which has followed it. So let's together take an overall look at your life, and especially when it began to confront you with challenges that threatened to get out of hand.
Well, it was about 3 years ago. An important business lunch. But I wasn't consciously worried about anything. Suddenly, a dreadful feeling of insecurity. God, I was frightened. It must have lasted seconds only, because neither my companion nor anyone else noticed anything out of the ordinary. And then it passed away. But later, on the way back to my office, I couldn't seem to... Well, I didn't know where the curbs were. Over the last 3 years, it's been happening more frequently. Nearly always when seated at a meal. But never until today at home. A large gin and tonic has often helped, I think, to prevent the attack, but I can't go on like that.
Of course not. And you won't have to. Now, let's see what we've got. All your life you've been an energetic and conscientious man. Plenty of drive, anxious only about the outcome of things for which you've striven. But 3 years ago, your anxiety suddenly explodes, almost into panic, at a crucial business lunch. And for the first time, you had to struggle consciously to maintain control. You succeeded, but only at the cost of dreading having to go through all this again, right?
Yes, that's right. Eating out became quite terrifying. I used to try to avoid restaurants and eating in public as much as possible.
And this, of course, restricted your flexibility and efficiency and began to get you down.
Oh, yes, it has.
Well, that's perfectly understandable. Chronic tension and anxiety are demoralizing, and they do get people down. What we've got to do is to reverse the process. First, relieve the depression, which in this case is secondary to the anxiety, and then build up your confidence by enabling you to work through these frightening challenges without continuing fear.
The patient's relaxed hope and the doctor's confidence are both soundly based. This is a learned anxiety state, with chronic conditioned anxiety and secondary depression. And by recognizing it and prescribing the appropriate combination of medication for tranquilizing and antidepressant action, the doctor has demonstrated his grip of the case and given the patient confidence to deal with the challenges and crises in his life which had brought him to a state of total arrest. He'll need to continue in treatment under the doctor's care, but already the doctor has produced a diminution in tension, a calmness which will overcome the caution which the patient felt, clearing the path for him to go ahead. These measures are within the competence of every able physician. But even so, for every one you win, there are others who are losing.
Good. Stick around.
That was 12 days ago, Doctor, and you haven't moved from the house since. Don't talk like that, dear. You've done nothing to be ashamed of. It's taken me all this time to get him to come to see you, Doctor, and even then he'd only come with me.
So ashamed of... Don't know what to do.
Well, in fact, you've done exactly the right thing. Because you've faced the fact that you're at the end of your resources. And you've let your wife bring you back to me.
Back to you?
Yes, do you remember that you did come to see me about 8 months ago, and you were pretty scared and jittery then? And I gave you some tablets. And I told you I wanted you to take them. And I asked you to come back and see me in 1 week's time. And you never came.
Yes, I know, but... Well, you see, about those tablets, Doctor, well... Perhaps I was hoping for a miracle, but... Well, anyway, I didn't seem to be getting any better. And I was afraid that nothing could be done for me, and I didn't want to waste your time.
Well, something can be done, and it certainly won't be a waste of time to do it. Only this time, you're going to have to trust me, not magic, and do what I advise.
Oh, I will, Doctor. I'll do anything.
I know he will, Doctor.
Now, I want you to go to the hospital. There's nothing to worry about, because the principle's the same. And you see, we need their facilities. Only you'll have to trust them, just as now you've begun to trust me. And I know that they will be able to help you.
When we take a patient in hospital in this way, we accept that the doctor's diagnosis indicates that there's an element of emergency. And we've got, first of all, to screen the patient in various routine ways. We don't expect to find structural damage, but we often do find evidence of disturbed function, particularly adrenergic function. Routine procedures will have included skull and chest x-rays, electrocardiograms, where paroxysmal tachycardia may be a complication of panic attacks with a sense of impending death, and always a complete blood picture, including ESR.
The case we're about to see now presented as an acutely depressed, terrified, weeping man who'd become housebound. His GP had seen him before, but he'd been seeing him intermittently for chronic anxiety.
This anxiety has been exacerbated in the last few months by attacks of panic in certain situations, whereby the patient became conditioned to these situations and had to avoid them. This led to his becoming housebound. The GP was right to refer him because a housebound man can't be treated except in hospital. Our task then, of course, is first to relieve the chronic depression, without which we can't decondition him because he can't respond, and then, after this, to give him the individual deconditioning treatment. To relieve the depression, we use amitriptyline. To prepare him for deconditioning and to relax him, we use a tranquilizer, Librium or Valium, chloride, epoxide, diazepam. Well, we'll see if he's ready.
Before we see him, can I ask you if you'll be continuing the drug treatment during the process of his deconditioning?
Yes, the whole way through, because you see, amitriptyline is a long-acting antidepressant, and we really must have freedom from depression for his cooperation. And we need the tranquilizer because without it, he might not be able to stand confrontation, either in the consulting room or in real life, with the things to which he's become conditioned. Right.
Don't get up.
Good morning. How are you feeling now?
Well, I do feel better, Doctor. I don't feel so sort of hopeless anymore. You know, I can think.
That's fine, because we can use this capacity to think and to remember and to look forward, to help to release you from this trap of fears which have left you so miserable, so helpless.
Yeah, but what worries me is, I've had this fear for so long. It sort of got worse and worse, and kind of built up. I got feeling real panic.
Well, that's exactly it. You've hit it off. You've had them a long time. They've had time to build up, time to reinforce each other, time to spread and create a maze from which we can lead you out, but we need your help. I want you to make a list, before you come to see me this afternoon at 2:30 in my room, a list of all the situations which have caused you panic, from the worst to the most trivial, as you remember them in the order of the fear. Make that list between now and this afternoon, and I'll see you then. All right?
All right.
Fine. Thank you.
Wear a wedding ring, because he ain't got no father. Of course he has, everybody's got a father, you silly prick. Not a proper one, not married. What's that make him then, eh? A bastard! A bastard! A bastard! A snotty old bastard! A bastard!
And then I called her cow, as they called her. Well, she tried to explain to me about bastardy. It's just words. You'll understand when you grow up. You aren't the only one. There's many, many others like you. They're no better than you. You'll see what I mean. You'll understand. I hated her then. I knew I'd never forgive her. I wish that she was... I wanted her to be... and she left me then. Alone. Frightened because I had no one else and she was helpless. Somehow she... done it to me again. More pain, more shame. And then they took her away, and I thought I'd never see her again. I didn't know what to do. I didn't know what to do. She often painted my mother, often, nearly always in public.